Great.
Okay.
It looks great. Okay. Hello, everybody, and thank you for joining us for another one of our Meet the Specialist sessions. Today, we have one of our newer specialists to on board with us, the very lovely Dr. Melinda Pascoe. She is a leader in neurological and neuropsychological consulting. She has many years' experience and is absolutely fabulous, so that you can get to find out a little bit more about who she is and what she does and her specific expertise. I'll hand over to her now. Thank you so much.
Thank you. Well, hello, everybody. It's good to put a face to a name so that when you have clients, you know who you're referring to. And it's often quite taxing for people to see medical specialists and they get quite nervous. So I try and put them at their ease. My expertise is I'm a neurologist and I've been a neurologist for a long time. I did my subspecialty training at the Mayo Clinic in Peripheral Nerve Diseases. So I'm particularly trained in that area, although I look after all sorts of general neurological conditions and have had a lot of experience with clinical work. I only do private clinical work now, so I'm not in any research or anything like that. I most recently did a Master of Health Law at the Sydney Uni, and I completed that at the end of last year, so that's given me a slightly different perspective, and I do think it's enabled me to do better medico-legal reports than previously. I see all sorts of patients and all sorts of clients, ranging from people who have organic illnesses with after injuries, medical negligence, etc., but also functional neurological disorders, which are sometimes very hard to delineate. So my main aim is to give a very balanced report. I actually don't want to be for one party or another. I like to, I talk to the client and get their perspective, and I then use the brief to get some objective evidence that either supports or refutes what they say. So for me, it's the balance of being straight down the line and truthful and reporting what they have. I think that's probably about all I can say, but I'm happy to field any questions that might be more beneficial to everybody.
Lovely. All right. If anyone would like to ask a question of Dr. Pascoe, you can unmute yourself and ask that question now, or if you like, you can pop it in the chat.
No question.
While you're thinking of that, I have two questions from people who are unable to attend today. And one of them is, what do you like in a letter of instruction? How much detail in the questions do you need?
Probably not a lot. I do a report based on the information provided by the client and in the brief. I form an opinion, and that opinion, and then I do an impairment, and then I answer specific questions. So I think it is vitally important to have the specific questions so that I'm addressing what the lawyer needs and wants. I think that I do get history from the lawyer in the brief. I don't think that's so pivotal, but you need to be quite clear in what you're trying to discern in the questions. And I do that in every case, because I never do a report without having a brief that has a set of questions that people want answered, because I'll give them something they don't want. Okay.
Good answer. Thank you. And the second question is around CTE, which is emerging in a number of spaces, chronic traumatic encephalopathy.
Right.
Have you been involved in doing assessments in that, or are you aware of all that?
Just let me turn that off. Sorry, I meant to turn it off. No, I haven't been involved in that, but that's essentially brain injuries and how to assess brain injuries. And I've certainly done a lot of work in regards to acute traumatic brain injuries, such as motor vehicle accidents or strokes, or that sort of anything that damages the brain, whether it be repetitive injury or one-off injury, can be assessed. And there's a way of assessing that effectively and objectively. What I think is clear to me is that people's psychological condition can be... Okay. People's psychological condition can have a marked impact on their perception of their problems. And so in any of these assessments of brain injuries, I think there needs to be some objectivity brought in. I could do a clinical examination, which is very, very basic, and the investigations that are normally done in the process, such as CTs and MRIs, are very, very basic investigations. And it doesn't look at the psychological aspects, nor does it look at the cognitive effects of any traumatic brain injury, whether it be a one-off or repetitive brain injuries. Does that answer your question?
I hope so. The person who asked that was unable to attend today. And I have another question, just an interesting question for those who are watching. And that is, how long are your assessments? And what could a client expect when they turn up at your rooms because they've been sent by their lawyer or their case manager to see you?
Right. I think the in-person assessment for me is very important. There are a lot of subtle clues when you're a neurologist that you see in a client that presents to themselves. If you only have the information on paper, you will miss a lot of those subtle non-verbal clues. You can also detect whether their complaints are likely to be organic or if there's significant psychological impact on their presentation. I'd usually talk to people for however long is necessary, but it's not very long because I think it's quite demanding. Plus, I've got all the information in a brief. So what happens is most patients can remember very little of the information that I need because it expands over a number of years. So yes, I ask them what happened and when it happened. Sometimes they remember, sometimes they don't. I ask them the progress of what's happened over the last, often 3 or 4 or 5 years. Often they don't remember, and really nor should they. And so you use contemporaneous notes to support that. I then do a physical examination, and the physical examination is quite brief. It's certainly not painful, and nor should it be painful. And I say to the client, I'm not here to cause you any discomfort or pain, and if I do, you must stop me. So I'm trying to make the assessment as non-traumatic as possible. And I understand that often clients are quite traumatised by the very fact of being seen for independent medical examinations. So I try and temper that a bit with some kindness, and then just get the objectivity and get the objective data that I can from a clinical examination, which is limited. Clinical examination in a neurological perspective is not like a orthopedic examination or a skin examination. I mean, neurology is heavily superimposed with psychiatric and psychological content. So some of that can be brought across. For example, if somebody is distressed by me even asking things and they admit to a psychological injury, that would support that. So I mentioned that in the, have I answered your question? How long? Probably I leave about an hour, but sometimes it doesn't take that long because I just need to get the information. I don't need to spin it out for a set time frame.
And what's your view on having a support person, whether that be a spouse or a carer?
I don't have a problem with that at all. I don't like it if they are, and I stop them if they're going to contribute to the history. I don't need a history from them. I don't mind them being a support person and there as a second set of ears to hear, almost like a chaperone, if you like. And so I don't have a problem with that. I only allow one. I don't want the whole family. Because that detracts from our interaction, the personal interaction with the client. And so the personal interaction with my client or patient, whatever the case may be, I think is really important. What I don't want is to have people go out of my office and say, oh, that was so awful. I just wouldn't do that.
Yeah. That's really great. It's really nice to hear, actually. I was speaking with some people from one of the large insurers this morning, and they were saying that one of the first and main complaints that claimants have when they give feedback on an assessment is that the specialist was dismissive of them or harsh to them or made them do something that caused them to be in pain. So that's really lovely to hear.
The other thing is, at the end of it, I ask them, do they think they've been heard? Because a lot of people don't feel heard. So they don't we ask them pointed questions, but in fact, some of the things, they have complaints that are not asked about. So I ask them, is there anything I've missed? Is there anything you feel you need to say that I haven't covered? So that they have some input into that process.
Do you find that people who have a brain injury doubt their own capacity, or are reluctant to say things lest they not be believed, or that be diminished because they have a brain injury?
I haven't found that, but I'm fairly open, and I'm fairly relatable. So, people often open up to me. So, they might say, for example, "Oh, I'm really stupid." Well, yeah, we're all a little bit stupid, but can you remember this? So I don't, I think I'm a little different that way to a lot of specialists. I hope I'm not arrogant. I really hope I'm not arrogant, because I think that that's not a good thing to be when you're looking after people.
No, not at all. I couldn't imagine that being said of you at all. No, you're absolutely delightful. Now, does anyone have a question that they would like to ask?
Let's just see, it's burning in people's brains to ask me something.
I know.
Be brave. It's okay.
Like people do want to ask. Come on, Michael, have you got a question?
People get a bit shy with these things, I know.
They do. Look, I'll let you go. These are only short little vignettes, but what I would say is thank you for making the time to come and meet our Dr. Melinda Pascoe, who is one of the jewels in our crown. She is based in Queensland, in Brisbane, and she doesn't do telehealth assessments for the reasons that pretty much that she's spoken about, which is that human touch and that personal association with the client. But she is well worth travelling your client to Brisbane if the need be. If you would like a copy of her CV or any further information, you can contact me. You will receive the recording of this session later today, and of course it and all of the rest of our seminars will be available on our YouTube channel or on the Mag Connect platform on the seminars button. Thank you all. Thank you very much, Dr. Pascoe. Have a lovely rest of the day.
You too. Bye-bye now. Bye.
Bye.